perpetuated by westernized nations that the best way to a healthy life is by avoiding as many microorganisms as possible. Early childhood in America and other Western countries is characterized by the overuse of disinfecting wipes, sprays, and sanitizers, which eliminate the plethora of microbiota previous generations were exposed to in the natural environment. The hygiene hypothesis is a recent theory that states a lack of early childhood exposure to infectious agents results in a less diverse microbiome, or the collection of all microorganisms within the human body. These microorganisms form symbiotic relationships within the skin, gut, and other body systems of human hosts. Lack of diversity within the microbiome has shown a greater susceptibility for autoimmune and allergic diseases. This idea is demonstrated by the greater prevalence of morbidities such as asthma, atopic dermatitis, and inflammatory bowel diseases in westernized nations versus developing nations. Contributing factors to this phenomena include the small family sizes of typical Western households, as well as large urban households with high antibiotic use. This leads to an unchanging microflora presence in their lives and within their body. In addition, there are generally less parasitic helminths within the natural environments of developed nations, and effective sanitation systems that almost entirely eliminate the oral fecal burden of disease transmission. In contrast, developing countries are largely characterized by bigger families, rural homes with livestock, and low antibiotic use. This allows for a variable and transient set of microflora. More helminths and other parasitic infections are present in the natural environment, and less established sanitation systems cause a higher orophycal burden. When children are exposed to bacteria and parasites early in their life, it aids in the development of a balanced immune system. In children not exposed to these types of microorganisms, the immune system's regulatory mechanisms are not properly controlled. This leads to an overactive immune response towards non-pathogenic microbes. This overactivation of the immune system can happen because children's Th1 immune cells must be primed for pathogenic microorganisms during immune system development. When Th1 cells are not primed by bacteria, an excess of Th2 immune cells result instead. This allows for an overactivation of Th2 cell responses when previously harmless pathogens enter the body. This is what is shown by common allergic reactions such as asthma and eczema. Essentially, this means if you have more Th1 cells or a good balance of Th1 cells and Th2 cells, you have a healthy microbiome. But if you have more Th2 cells, you will have a less healthy microbiome and a higher risk of asthma, allergies, eczema, and rhinitis. Once allergies are developed, immunotherapy in the form of allergy shots has been shown to push the immune system towards a better controlled Th1 response through the gradual controlled exposure to allergens. Other forms of interventions aimed at early childhood development are still in experimental stages. A study conducted in the United States showed the hygiene hypothesis by contrasting an Amish population against children in the general suburban population of Indiana. In an allergy sensitivity skin test, Amish farm children tested positive in only 7% of the population, compared to 50% of the children in the general population. Research is still being conducted on the hygiene hypothesis. However, it is clear that eliminating microorganisms, which previously was thought to protect children, may actually be detrimental to their health in the long term.